just too frustrating, and you tell me over and over and over again, my friend, I don't believe we're on the eve of destruction.
So we're getting a lot of people here, and a lot of people came up and said, that's my representative. And the representative says, teamwork makes the dream work. Yeah! All right, our next speaker is going to talk about layoffs. An epidemiologist with the state of Minnesota Department of Health got laid off. And can you believe that? And her name, we need that, right? Olivia Dillon, she's going to talk about her story and what happened. And what the heck? You know, with all the germs that are going around? Olivia.
On April 1st of this month, my world was turned upside down. I was laid off from my epidemiologist position at the Minnesota Department of Health because of President Trump's unconstitutional attacks on public health funding. I worked at MDH for 2.5 years in various roles, including the Unexplained Deaths and Critical Illnesses Program, Viral and Bacterial Respiratory Response Surveillance, and health monitoring for people who have had contact with avian influenza. I'm the one who reaches out to farm owners and their employees after confirmed avian flu exposure, and I coordinate their influenza testing. I'm the point of contact at MDH for medical examiners when they investigate deaths that appeared infectious. I saw daily how our work impacted all Minnesotans. I'm here today to talk about a public health emergency, the layoff of the hundreds of employees at MDH, many of them represented by my now former union, the Minnesota Association of Professional Employees, or MAPE. MAPE members at MDH spend their careers preventing harm before it happens, and now our expertise is being discarded at a time when disease threats from measles to avian flu are rising nationally. These staff cuts will impede the state's ability to prevent and contain outbreaks, significantly reduce support for nursing home patients, delay lab results and patient care, reduce funding for tribal public health, and so much more. Like me, my colleagues who were laid off were experts in their field. Minnesotans now face serious risk to the health and well-being of our communities. If Medicaid is also cut, the impact on health will be irreversible. I'd argue, however, that we are already in a place where this impact is irreversible. When you combine these losses at the state level with those at CDC, FDA, and other federal agencies that provide services to the public, we are no longer able to investigate outbreaks to the same level we did before. Legislators have spent a lot of time the past couple of weeks talking about current and potential federal cuts, yet legislative funding proposals are still failing to meet the challenges that we are facing in the state budget. We must do so much more and be so far bolder in our revenue asks to fix these problems that we are experiencing now and to prepare for the impacts of the federal government in the future. One of MAPE's slogans is "The state works because we do." The same is true of all workers and communities that are represented here today and the hundreds of thousands of more across the state. I do want to thank all of the elected officials who have been here today, who have pledged to fight along with us. We're here to advocate. We're all here today to advocate for the often unseen but critically essential programs that protect and expand public well-being, and we will keep fighting to preserve them. We are strongest together, and I hope each and every one of you are able to keep the fire in your soul and under your feet to stop these attacks on public services, because they are our public services. The health of all Minnesotans' bodies and minds do depend on each of us having our voice heard and our actions felt. Thank you.
I don't believe we're on the eve of destruction.